Plasma-rich platelets, it's a type of injection that we have now that's available to our patients in the office here at Riverside Orthopedic Surgery Centers here in Gloucester. And so this is a new way of treating different diseases in the musculoskeletal system. The age group for this procedure, it's actually anywhere from your 20s, 30s, all the way to your 80s and even 90s. Most of the folks that are coming in to get this procedure have some kind of arthritis already. So they're gonna be in their 50s or 60s or 70s, and they already have some degree of arthritis, and that's probably the most common indication for this procedure. We do also offer this to the patients that have injuries to recover a little bit quicker, and also the ones that have tendinopathies such as tennis elbow, plantar fasciitis, bursitis of the hip, bursitis of the shoulder, and also the ones that have partial rotator cuff tears. This is done in the office. You don't have to go to the hospital for this. This is done in our actual office. We schedule the patient usually on a Friday to do this. It takes about 30 minutes or less to do it. Patient will come in and they will have the blood drawn by our staff. After that, we spin the blood, and then in a sterile fashion using an ultrasound machine, which is a machine that allows us to image the actual area that we're going to inject the PRP into, and make it a little bit safer for the patient by visualizing and avoiding having to hit a bone or a tendon into the correct area to treat the problem at hand. And then the patient goes home. We usually ask the patients not to take any non-steroidal anti-inflammatory agents for at least 2 weeks before the procedure and for at least 4 to 6 weeks after the procedure. So the timing for recovery from this procedure is usually about 4 to 6 weeks, although some patients can take even 2 months after the actual injection. Some patients claim that by 4 weeks they're already seeing some favorable results, but most of the time it's about 6 weeks. So usually we perform the procedure on a Friday and we see the patient back in about 6 weeks to make sure that they're doing well. We have been doing this procedure for quite some time now. The patients are getting good results, and we have had good success rate for various elements of the musculoskeletal system.